to the audience?
Oh, I'm a consultant psychiatrist and I'm the head of mental health services at the Palestinian Ministry of Health.
Okay.
I'm talking to you from Jerusalem.
Okay.
Uh,
Um, may I please introduce you to the audience first and reading your CV first?
yes, please.
Okay, thank you. So, Alhamdulillah, today we have in our second session is Dr. Samah Jabr. She has an outstanding experience and expertise in her years of work. From 2016 to date, she is the head of mental health unit in the Palestinian Ministry of Health. And from 2007 to date, she is a psychiatrist and psychotherapist in Tawassul Center for Mental Health from East Jerusalem. And since 2011 to date, she is a clinical assistant professor in the Division of Global Psychiatry, George Washington University in Washington, D.C. Among her published researches are she has published the association between post-traumatic stress symptoms and suicidal ideations among Palestinians, the mediating role of sexuality, social support, and mindfulness. And in February 2023, she also had given a lecture titled Race in Pain and Resilience, the Global Reverberation of Palestinian Historical Trauma in Princeton University. And in 2014 to 2015, she has conducted a research in the Harvard Medical School Graduate Clinical Scholars Research Program, or GCRST. So, mashallah, it's a very outstanding work that you have been doing, Dr. Samah Jabr. We are honored to have you here today. Without any further ado, please join me in welcoming Dr. Samah Jabr. The time is yours, ma'am. Thank you.
Thank you very much for a very generous introduction, and it's a pleasure and an honor to be with you. Assalamu alaikum for everybody, and thanks for centralizing Palestine and giving a slot of your time in the conference to talk about the situation in Palestine. I will be talking in general about the theme of enhancing Muslim mental health in times of crisis and sharing some lessons from our Palestinian experience. And in continuation with the discussion we've been listening to from Professor Pavlov, I just want to explain what do I mean by psychological imperialism, the assumption that psychological knowledge generated within the minority world is universal, general, and superior to what exists within the majority world, importing psychological knowledge into the majority world. So we see the hegemony of concepts and practices coming from the West, and the assumption that they apply to every part in the world, regardless of the great differences. Let me give you examples of the manifestation of this assumption of Western hegemony. I will give some examples, and maybe by the end of the lecture, it will be easier to understand. Nowadays, you know, there's big crisis in Gaza, and governments of the West, including the British government, they try to provide humanitarian aid. On the one hand, they give military aid and diplomatic aid to the military operations that are taking place in Gaza. On the other hand, they try to provide some humanitarian aid as a false charity to Palestinians to ease their guilt about what's going on, or to blur the vision of people, assuming that, okay, we are giving something to Palestinians. And among these things that they give is something that they call dignity kits. And dignity kits are, in fact, hygiene kits that contain soap and toothbrush and sanitary pads for women. What a misnomer, because the concept of dignity is way more abstract and large and vast for Palestinians than the material kit for hygiene. And to say, when David Cameron made his speech, when they gave the dignity kits, he said that every Palestinian woman deserves a dignity kit. This language also enlarges the gender split between the victims, where men are seen as perpetrators and less worthy of Western empathy. And there is an assumption that women have nothing to do with this and they are victims of their own men. So I just want to give this as an example of the colonial language that is being used in humanitarian aid. Another example is with the something that we observed when the workers from World Central Kitchen, 6 of them are internationals, were killed. International papers and media wrote about the news. They described their personal profiles, their families, their pictures, while every day humanitarian workers get killed in Palestine. We barely know their numbers. There is no human face for them. So also that's another stark example where we see the dehumanization of the population. We are unseen. That's the list that we can see. Now, a few things about mental health in Palestine, maybe examples from my clinic to make you connect between the political and the personal and how they intertwine in a context like ours. And then I will explain the context. Let me give the first example. Disordered eating. In mental health, we've been hearing about eating disorder when a young girl, for example, who has many preoccupations about her body image, comes with changes in eating behavior and weight loss. What we have been observing is young Palestinian boys and girls, adolescents, with severe weight loss, inability to eat. They don't have the body image problem. But when they explain why they don't eat, they say, I feel disgusted. I feel a lump in my throat, a thorn in my throat. When we observe starvation in Gaza, we cannot eat. How can we eat? We feel guilty about eating. One child, her father told me that she becomes hysterical whenever he brings one child in the West Bank. Her father says she becomes angry whenever he brings meat or fruit home, any luxurious food. She has been hoarding canned food and bottles of water underneath her bed, saying that the genocide will come to the West Bank. So those are examples to show how the political intertwines with the personal. Another example about women with depression just during their pregnancy or just after giving birth. And that is not new, that is not strange. What is remarkable is that over the past year of genocide, I've been listening to a new attribution. These women express feelings of regret and guilt. They say, I regret that I am bringing vulnerable beings to this unsafe world. A final example that I will bring from my clinic a few days after following the assassination of the Lebanese leader, Hassan Nasrallah. Out of 16 patients that I saw in my clinic for therapy, 5 chose to speak about the assassination and what's taking place in Lebanon. Palestinians are very concerned about what's taking place in Lebanon. I'm sharing this because for me it is stunning that 5 out of 16 choose to prioritize the political reality over their personal stories. These are people who come and talk about work problems, jealousy about the partner, but now a big political event becomes the priority for them. This is an example of the clinical practice that I do in Palestine. Something from liberation psychology that we learned from Martin Barou. He says that trauma is socially produced. To speak of psychosocial trauma is to emphasize that trauma is produced socially, and therefore that understanding and resolving it require not only treating the problems of individual, but also treating its social roots. In other words, the traumatogenic structures or social conditions. we can just take this phrase, remove the social and write political, so that it will perfectly fit into the Palestinian reality. A few images to explain the context in Palestine. This is the a famous picture about land theft in Palestine. It's a story of land grabbing, leaving the Palestinians living in fragmented geography, very small percentage of their historical land. 2/3 of the Palestinian population are displaced outside Palestine. What remains of Palestinians on our land are only 1/3. 2 millions living in Gaza, 3 millions in the West Bank, but on fragmented geography. And this reality of geographical fragmentation creates different indicators and different determinants of health and mental health. We need to understand this, because when people ask me about what's the prevalence of mental health disorders in Palestine, my answer is, which part of Palestine are you talking about? Even though Palestine is very, very small geography, but there are different determinants of health that create different reality. I will share a few images that explain everyday violence in Palestine. I'm not talking about the year of genocide. I'm talking first about the century of oppression and occupation. This is how we cross checkpoints early in the morning, laborers, university students. In order to go from one town to another, from one city to another, we need to cross the checkpoint, and this picture is at dawn. The other common reality is political detention, which touches 20% of the Palestinian people. Usually it starts when Palestinians are minors, and it is a strategy to damage the individual psychologically. Torture and maltreatment, mistreatment are commonplace when a person is politically detained. It aims to break the individual, to inject guilt in the family, and to intimidate the Palestinian society so that we keep quiet. And this is a paper that I published earlier explaining how the whole process makes people sick, mentally sick. It creates a lot of psychopathology, interrogation. The third common experience is displacement and home demolition. And home does not mean for us only the material place. It's the place where we developed our early attachments, our bonding, our memories, our relationships. And all of that is taken when the home is damaged and people are displaced. It shakes the identity of people. And this is not only happening massively in Gaza, it's happening everywhere in Jerusalem, in the West Bank area C. So they have been describing the impact of violence on Palestinians with the terminology of PTSD. And I have been arguing that there is no there is no P, there is no post. We are never in the post phase. Trauma in Palestine is colonial, cumulative, cross-generational, and collective. And so the usual interventions that are useful in PTSD, like EMDR, trauma-focused CBT, will not be adequate in the Palestinian situation. If you look at a child in Gaza who's 14, 15, he has lived, even before the genocidal acts that are taking place now, this boy has lived 4 wars and an excessive violence in reaction to the March of Return. Health indicators are very poor. Food insecurity was 60% in Gaza. So you can imagine that this kind of trauma, it affects the development of your brain. It's not only one event with a clear beginning and a clear end, like a car accident. And above all, trauma is engineered. It is deliberate. It is made with an objective to break the psychology of people. A few slides about the current situation in Palestine. So we see massive bombardment, the situation in Gaza, massive bombardment that left the people who have been living in an already highly dense place. Gaza was a very highly dense place, but now everyone is pushed into 11 to 12% of the original space of Gaza, and the rest is demolished completely. And this bombardment has killed so many people. The other tool of implementing the utmost death and suffering on Palestinians in Gaza is by targeting the health system. So we see that people are not only dying due to bombardment, direct killing, or shooting, but also because the health system collapsed completely. More than 1,000 health workers were targeted and killed. Every hospital was partially or completely shelled. Ambulances were targeted right from the beginning. So people started dying from infectious diseases, from communicable diseases, from chronic problems, people who don't receive their diabetes medication, renal failure, oncology, all of that kills people. And the third methodology is deliberate starvation, weaponized starvation, which is taking place especially in North Gaza, but everywhere. And Oxfam said that people are surviving on 12% of the daily requirements of calories. And the fourth methodology is the attack on the United Nations Relief and Works Agency, which has been sustaining the health system and the educational system in Gaza. This is the second year where the Palestinian kids in Gaza, who are almost 1.1 million people, they don't go to schools. Palestinians who have been so keen on education because it's our survival tool are now deprived of going to schools. Every school in Gaza is demolished. Now, this is an important paper from The Lancet that argues that the official numbers announced by the Palestinian Ministry of Health are not true. They are just the tip of the iceberg because they count the bodies and they collect every person with the fourth name of that person. There are many others who don't reach the emergency rooms where their names are registered. It argued in July 24 that the actual number, they have a special equation to count for the people who die from communicable diseases and other problems. And they calculated that 185,000 people were killed due to the intense military violence in Gaza. This number, if we project it until today, it will be around 250,000. Why do I say this? The crime is a crime, whether you kill one person or you kill 250,000 person. But if we have all this ambiguity in counting the physical injury and death, how can we count the psychological impact on the psychological impact which is less visible? How can we quantify the pain? I saw the other day a video of a boy in Gaza. He's 8-year-old. His mother was killed 2 months ago, and every night he sleeps on her grave. He wants to feel her. How can we quantify this pain? That's the important question for us as mental health workers. So here I want to say a few words. I will not repeat what my colleague, I totally agree with what I heard from Professor Pavlov, but let me say a few things about our problem with the Western approach. The definition of trauma misses so much of the Palestinian experience. It's about threatened death or serious injury or sexual violence. All of that is taking place in Palestine. But if a soldier spits in the face of a Palestinian university professor in front of his students, this is not considered to be trauma according to the DSM definition. Humiliation is the most common trauma in Palestine. I work with women who were in political detention. When a woman needs a sanitary pad or toilet paper, when she's bleeding in prison, she's asked to dance to the Israeli national anthem, to kiss the Israeli flag in order to get her basic need. So this is not considered to be trauma. And in in the Palestinian experience, this is an assassination for her psyche. And we need to find our own ways of describing our pain and its impact and how it affects individuals. This is very common in Palestine nowadays. The WHO definition of mental health is about the individual. When the individual realizes his or her own abilities and can cope with the normal stressors of life, can work productively and fruitfully, and is able to make a contribution. So this means that I can forget about the collective, forget about my people, and work on my personal survival, and I will be healthy. But in Palestine, people tell you about the collective mood, about the pulse of the street. We feel like we are one. We cannot be okay when our people in Gaza, in the West Bank, are suffering and going through genocide. So the overemphasis on evidence-based science, positivism, individualism, hedonism, homeostatic approach, ahistoricism, political neutrality, they don't work fine for us. Take hedonism, for example. In hedonia, we study that it is part of the depression or one of the negative symptoms of schizophrenia, but we know that a loss of joy and can be a symptom of oppression, a symptom for the colonized people. It was described in the books of Fanon that the French used to say that the Algerians were lazy, not motivated to work. Why would they work for the benefit of the colony, not for their own benefit? So it's normal that people lose motivation and interest and joy because of colonization. Maybe I will come up, will explain later a few of these things. Some surveys which use in a simple way for example, the WHO-5, the well-being questionnaire, they distribute it to Palestinians. If you score poorly, they ask you a few questions. Did you sleep well? Did you wake up refreshed? And so on. And if you score poorly on that, they will conclude that you are depressed. And actually, they are using the individual measurement unit to study the psychological impact. But we know that trauma does not only harm individuals, but it breaks the social fabric between people, between individuals. So the use of these surveys pathologizes the people without solving their problem. And if we conclude that 80% of the people are depressed, what are we supposed to do? To distribute Prozac to everybody? I don't think that this is what is needed in Palestine. Another study by the World Bank. These studies were even before last year, the year of genocide. It concludes that 70% of people are depressed. Colleagues, an example of the pathologization, this image comes from a medical note. This is a woman who comes to an Israeli emergency room in Jerusalem. The woman saw her home being demolished. Of course, she started shouting, crying, hyperventilating. She developed carpopedal spasm, numbness around the lips, symptoms that are similar to panic attack. And when she went to emergency room, they didn't want to hear her story. No time, no place for her to tell her story. Very quickly, they gave her the diagnosis of emotionally unstable personality and malingering. Colleagues, this is an image that comes from Archives of General Psychiatry, 1974, which connects between protests for civil rights for the Blacks and the antipsychotic medication Haldol. This is another example of pathologization. This is a guy, Khadr Adnan, who managed to free himself several times. He was no charges against him, but he was in prison 5 times for administrative detention. Israelis call this administrative detention, which can go for an open period of time. They can renew it and no charges. And every time he had to go through hunger strike to free himself. He managed to do that, and he encouraged many Palestinians to do the same. Last time he was left without medical care until he died. When he died, Israeli journalist wrote that he committed suicide. And this is an Israeli trauma expert, Ayelet Shmuel, who says that all Palestinians in Gaza are sociopaths and we need to get rid of them. And this is an article from Haaretz, the liberal Israeli paper, which psychoanalyzes the pro-Palestinian protests in the West, saying that these people harbor unconscious anti-Semitic feelings. Colleagues, there is one of the leaders of the FLN, of the liberation movement in Algeria 70 years ago. His name is Al-Arabi Ben Mahdi, was killed by the French colonizers, and they arranged this scene to make people believe that he committed suicide. Just recently, 70 years later, just recently, Macron admitted that the French regime killed him and that he didn't commit suicide. Accusing people who have the potential to be national heroes of committing suicide is a way to damage their status in the society. So they are using the stigma that is prevalent in these Arab Muslim societies to damage the status of people who have the potential to be heroes and to be followed by others. Another starking image from Jerusalem. This is a Google Earth image of an area that is called Deir Yassin in Jerusalem, where one of the worst massacres took place in 48, in the acts of the ethnic cleansing of Palestinians in 48. It started by getting into the bakery and getting the son of the baker and pushing him into the oven, and then killing hundreds of people who lived there. Now, and every home was raised in that village, and Israelis built a psychiatric hospital. Now, if I need to hospitalize a person from Jerusalem, I need to hospitalize him in the Israeli hospital Kfar Shaul, on the land where the massacre of his grandparents took place. Next to the hospital of Kfar Shaul, there is the Holocaust Museum. Another stark comparison. So the Holocaust Museum is built to make people sensitive to the memory of the victims of the Holocaust, which is fine. But this is in complete oblivion to the Palestinian victims of trauma. So there is hypermnesia for the Jewish victims and complete oblivion for the Palestinians. Hypersensitivity to Jewish loss and grief, and complete insensitivity to ours. I'll share with you a few things about our approaches to mental health. We've been integrating mental health in primary health care, in school setting, training religious leaders, community leaders to provide response, because mental health professionals are very few and we invest very little money in mental health, unfortunately. Now, nevertheless, we managed to build an effective system which was working until last year. With the beginning of the attack on Gaza, and within a few weeks from October 23, Israelis bombarded, shelled completely the only psychiatric hospital and every community mental health center. They used to serve 40,000 people with severe psychiatric problems like schizophrenia and bipolar. Those people roamed in the streets with no medication, with no contact with professionals. Many of the professionals that I trained in Gaza were killed. Everyone else is displaced. They only have the shirts that they wear and a few important papers. So the system was crushed completely. Colleagues, we cannot treat what we don't acknowledge. And this is an anthropologist, Rosemary Sayer, who studied collective trauma in Western literature, and she shows how the Palestinian collective trauma was excluded. It is not mentioned. The expulsion of two-thirds of the Palestinian people from their home in 48 is not mentioned as a collective trauma in Western literature. This is how we Palestinians conceptualize our trauma. We think we can best think of what's taking place in Palestine through the perspective of historical trauma that lasted over a century, from the Balfour Declaration until the year of genocide that started in 23. And we explain here that the impact does not touch only masses of individuals with the usual construct of symptoms of PTSD, but also it damages the social fabric, makes some people internalize a feeling of inferiority, makes people become envious, competing harshly on the leftovers of what remains of their land. So the impact on the society is so huge, and Western psychology has not provided us with suitable tools to heal the social fabric of the community. As you see here, it is colonial, cross-generational, cumulative, and collective, and it goes from one generation to another through the narrative, the broken attachment, and the inability to bond by the traumatized parents, and the epigenetics. The impact is huge and passes from one generation to another. And we, let me go to this slide, we conceptualize a different way of intervention. In Palestine, if we talk about self-care without talking about community care, this will be offensive to people because they find it as egocentric and self-centered behavior. We need healing spaces and listening groups much more than individual therapy. We perceive resistance and advocacy as and seeking for justice, healing justice, as part of the therapeutic process for the Palestinian society. Culture and spirituality have played a very important role, and really we mental health professionals need to be humble and just observe how the community is helping itself and just follow what they do and try to strengthen them. Global solidarity with Palestine is very important and should be strengthened. When official regimes in the world are complicit or ineffective in regarding what's taking place in Palestine, the mass protests, the mass demonstrations in different parts of the world tell Palestinians that our pain is acknowledged, our feelings are validated, and this has a therapeutic value for Palestinians. Searching for truth and for justice is also very important, even if we don't achieve it in our lifetime, but we believe that seeking justice by itself is a healing process, is a healing journey. And many Palestinians are willing to take this journey. Colleagues, a few words about political neutrality and impartiality that have been imposed on us for so long. First, I want to say that mega big Western organizations have been very hypocritic, and this hypocrisy was exposed when the crisis in Ukraine erupted, because they stopped being neutral and impartial, and they became very vocal about what's taking place in Ukraine. But this silence and neutrality was claimed regarding what's taking place in Palestine. The American Psychiatric Association and the American Psychological Associations wrote passionate statements in support of Israelis who were killed on October the 7th. as if the history started on October the 7th. And they have been quiet, not only about the century of colonialism and repetitive trauma of Palestinians, but also about 1 year of genocide. 1 year of genocide that resulted in massive killing and unprecedented harm on the Palestinian people. We see that our role as mental health professionals is to challenge these organizations because there is a very hypocritical position to claim that we care for the traumatized individual when we don't spread preventive messages about political violence. During COVID, colleagues, the role of a doctor was not restricted to treating the person who captured the virus, but to spread messages that will minimize the communication of the virus between people. So that's our duty and our ethical commitment. If you receive a child who is a victim of abuse, you don't only treat the child, but you make whatever you can within your power to stop the violence and abuse. And mental health associations have been quiet and complicit and silencing their members when it comes to the genocide of the Palestinians. Examples of collective trauma, healing circles, open spaces, listening groups, easier to tell bereaved mothers to go for an embroidery workshop. They will like it better there. They will help each other. They prefer it to interpersonal therapy, where the therapist has power and they are at the receiving end. But in a healing group, they support each other. A woman who is wounded by the loss of her son can give support to others and can receive support from others. We need gender-specific approaches because the violence has been targeting different genders differently. Participants in community interventions, they can reflect, digest, integrate, learn, and transcend. And people can reconnect. People who are supposed to kill each other for food, they will reconnect, they will relate, and they will belong. This is an example that we developed in Palestine. It is based on the symbolization of kites. In Palestinian child literature and in our songs, the symbol of kites is very important. And even the theme of flying is very important. You come from Islamic heritage, you are all Muslims. And if you remember in the year of sadness, what happened after the year of sadness to the Prophet? Al-Isra wal-Mi'raj. The Prophet, there was Al-Buraq, and the Prophet came from Mecca to Jerusalem over Al-Buraq. So you understand the metaphor and the symbolism. This was a journey to soothe the Prophet after a year of sadness. And we Palestinians have lived a year of genocide and sadness, and people try to transcend over the pain by the metaphor of kites, and we gather kids, they collaboratively, they make kites, they use the white paper to write whatever messages they want for their beloved ones, the lost ones, the killed fathers, the killed mothers. They go and fly the kites, they come back and they reflect on the experience. They can we allow them space to talk about their loss and the homes that they were destroyed, the place that from which they were displaced. Another example, there is starvation, but some people gather seeds and make seedlings and encourage people to plant. Unfortunately, this man who started this initiative, this project, encouraging people to plant their food in buckets wherever they can, he was targeted and assassinated a few weeks ago. Another example from the West Bank, from Jenin. In Jenin, in 2002, there was an attack, an invasion that killed many men, and the children of the lost fathers, they used the debris of ambulances. There also ambulances were shelled. They made this horse from the debris of ambulances, and it has been there at the roundabout in the Jenin camp to symbolize the loss, the resistance, to commemorate the Palestinians who fought in protection of their camp. Unfortunately, just recently, Israelis invaded the camp and they confiscated this horse. Palestinians have been politicizing some terminology that is common in Palestinian literature and in Islamic literature, like ribat, the connection with the mosques. They have been politicizing the concept of ribat to strengthen the people's resistance and protection of Al-Ibrahimi Mosque and of Al-Aqsa Mosque. The term sumud is also a term that is similar to resilience, but more elaborate than resilience. It has been in Palestinian literature since the British Mandate, much earlier than resilience. And it's not only the state of mind, the psychological well-being and bouncing back. It is also action-oriented. It is the things that we do in defiance. It's the action. It's not only the reflection, but the action in defiance to the attempts to uproot us and displace us and eliminate us. This paper was published in French, but it argues that resistance is therapeutic. The action of Palestinian is reinforcing the agency. One of the definitions of trauma is that it is the disaster of helplessness. So any action against this helplessness is in a way, and in any action for justice, in the direction of justice, is healing and contributes to our therapy. I also want to thank the government of South Africa for initiating a process for the justice of Palestinians, and the international solidarity, which is felt when students all over the globe protest in protection to protect Palestinians. It is felt and appreciated by the displaced people in their tents. Martin Barou says that what we are looking for is an opening against all closure, flexibility against everything fixed, elasticity against rigidity, a readiness to act against all stagnation. I just want to say how this is integrated in our understanding of Islam. Islam has honored people's dignity. It emphasizes human dignity and freedom. Human dignity, not Muslims' dignity, everyone's dignity. We read this in the verses, and we have certainly honored the children of Adam. O you who have believed, be persistently standing firm in justice, witness for Allah, even if it be against yourself. Those are basic principles in Islam that contribute to our understanding and our readiness for liberation psychology in Palestine. Liberation from psychological fear and dependence on the oppressor. So fear them not, but fear me, if you are indeed a believer. The best jihad is confronting tyranny with truth. Another verse is, oh people, also something about the social transformation from racism to justice in pre-Islamic Arabia. That was the message of the Prophet in his farewell sermon. O people, your Lord is one and your Father is one. There is no superiority of an Arab over a non-Arab, nor of a non-Arab over an Arab, nor of a white over a black, nor of a black over a white, except by piety. So those are very important messages from Islam that have inspired many thinkers in Islamic history, and the contemporary ones are Malcolm X, Abdurrahman al-Kawakibi critique of tyranny and call for political reform, Ali Shariati from Iran, Farid Ishaq from South Africa, and a few more people. We belong to Allah, and to Him we shall return. This understanding, this faith, uh, through which the bereaved overcomes the suffering of loss and the pain of separation from the deceased. It establishes the hope that the beloved is in a better place and that they will reunite one day. Just as we emerge from the same origin, we will in the end meet at the same destination. That's the belief of a vast majority of Palestinians. And this is the thing that helps people stay steadfast and in sumud when atrocity comes across us. The word sumud, just as to say something, it is part of the Palestinian literature, but it is not separable from Islamic concepts. We know from Surah Al-Ikhlas, He is Allah, the uniquely one, Allah As-Samad, the eternally besought of all, the protector. He neither begets, nor is born, nor is there to him any equivalent. So invoking Allah's name As-Samad as a refuge during trials is a very important thing that Palestinians do all the time. When they see their homes being demolished, when their family members are left under the rubble, they just bring the names of Allah and talk about the names of Allah, because we have learned not to depend on any government, on any people. We just rely on the name of Allah and our faith. One of the verses that were repeated in the Quran is about the metaphor of the Moses and the Pharaoh. Go to the Pharaoh, indeed he has transgressed. We understand that it is not only our right to resist, but it is our moral and religious duty to challenge the transgressor. And this faith helps Palestinians to deal with our reality. In conclusion, colonialism and occupation shape the healthcare landscape. Humanitarian aid can disempower by pathologizing and fostering dependency. A decolonial approach prioritizes self-determination, sovereignty, and local leadership. Psychiatric frameworks often ignore the impact of political violence. Eurocentric models may not resonate with Palestinian experience. Muslim liberation psychology focuses on collective trauma and healing within communities. Islam and liberation psychology provide tools for enduring crisis. Palestinian Sumud serves as a powerful example of resilience, global solidarity needed to support oppressed communities. Colleagues, finally, I leave you with this image to tell you that there are networks of mental health professionals who try to focus on Palestine, learn about Palestine, generate knowledge from the Palestinian experience. We have developed them in different parts of the world. There are groups like networks of volunteers in mental health who just want to use their expertise and knowledge of mental health in the service of the Palestinian people. Thank you very much for listening. I hope one day we will have a network like this in your country.